Hi class. This week we are going to cover 3 of our assessment questions on this module. And I'm going to start, module 14. We're doing osteopathic, we're doing chiropractic, procedures, imaging, nuclear medicine, and radiation oncology section. So we're kind of covering a lot in this section. And you will notice with this test, I'm adding ICD-10-CM codes with this, so you're going to have to code the diagnosis and the procedure codes. So really watch that. And we're going to go over 3 of those today. And we're going to start with number 11. So number 11 on our assessment on Module 14 states, acute appendicitis was confirmed upon removal of the appendix in the OR. So our first code for this is going to be our ICD-10-CM code, because our diagnosis code is always coded first, and then our procedure codes are second. Never, never, never code your procedure codes before your diagnosis codes. So our acute appendicitis is what we need to code first. So you'll get your ICD-10-CM code book out, and we're going to start with acute appendicitis. So you're going to go to your index under appendicitis. And then once you get to appendicitis, we know what kind of appendicitis. It's acute appendicitis. So when I get to appendicitis, I'm going to look up acute to see if they have it specified for acute. And they do. That's the only information that we have, is that it's just acute appendicitis. We don't have any more information given to us. So we have to go with that regular basic acute appendicitis code, and that is K35.80. So now we need to go and check that in our tabular. Okay, make sure that we don't need anything else, and if there's any more characters within our code. We are going to K35.80. And K35.80 states unspecified acute appendicitis. So it just is an acute appendicitis not otherwise specified, which is what we have. Okay. So now that we have that, that's our first code, is acute appendicitis, and that's the only diagnosis that we have in our scenario. So now we need to go with the removal of the appendix, because that's our surgical code, is the removal of the appendix. So if you'll go to your procedure ICD-10 PCS files, we're going to go to the tables, because that's where it starts. Okay. So we're removing, so we're having a medical and surgical section. So we're going to go to medical and surgical. Then we need to decide the body system that it is dealing with. So this is why anatomy and physiology is so important, because you need to know where the appendicitis or the appendix is located. Okay. So if you don't know where the appendix is located before this recording, you need to make sure you look it up. You can Google it and see where it's located in the body system. For this, our appendix is located in the gastrointestinal system. So we're going to go to the gastrointestinal system. So now we are dealing with the gastrointestinal system, and we're going to click on the operation to access. Okay. So it is a removal of our appendix in the OR. So our first 2 characters are going to be 0D. Now, here's the thing. If you don't know what these operational values stand for, remember, you can go to where the tables begin and hit on definitions, and it will give you a breakdown of each one of these. So when we're dealing with removal of something, it's resection. Okay. So now we're there. If you will look, it gives you that cutting out or off without replacement of a body part. Okay, so we're taking out the appendix. So it's a 0DT is our first 3 characters in our code. Now we need to look at the body part. Which one of these is it going to be? If we look down our chart, you will find J is the appendix. Okay, that's what we're dealing with. We're taking out of our appendix. So our fourth character within our code is going to be J. So now we start here. What is our approach? Well, our approach, since we have J, our next approach is going to be open, because we didn't have that it was endoscopic. We didn't have that it was via natural or artificial opening. So that means that it was already open, and it's an artificial opening of it, and that it was opening by endoscopic. It's just they're removing it, and so you have to go with the open, 0. Okay? Then our last two characters in our code, it doesn't give us any choices other than Z and Z for our device and a Z for the qualifier. So that finishes out our code for this procedure on number 11. So the procedure code for number 11 is 0, D, T, J, 0, Z, Z. Now, what I'm noticing on some of the assessments is a lot of you are not putting a 0, you're putting the letter O for the 0, or you're putting a 0 instead of a letter O. So you need to be really, really, really careful on making sure that it is a 0 or an O. Okay, the zeros in this, it looks like a little bit longer. They're a little bit longer, and the O's are a little bit rounder, if you can see how the O's are. So be really careful when you're typing in your diagnosis codes. So again, our acute appendicitis came out to K35.80, and our removal of our appendix, the procedure code, was 0DTJ0ZZ. So you would click back up to the top, and it takes us back up to the tables. Now we're going to do number 13 together, okay? Number 13 states vaginal delivery of a single female infant with no complications, okay? So we're dealing with a delivery, just a vaginal delivery, okay? So we have to code the mama code, the diagnosis that our mama did a delivery, and we're dealing with the mama. So we're going to go to the ICD-10-CM code first to do our diagnosis. And like we've already learned, we're going to go to delivery first. Once you get to delivery, then you're going to go uncomplicated, because our delivery was uncomplicated. So when you go to delivery uncomplicated, it gives you the code 080. Okay, now we're going to check that code in our tabular. We're going to go to 080. Okay, once you get there in your book, in the tabular 080, it says encounter for full-term uncomplicated delivery, okay? So in orange, we can tell that that's all the characters that are required for this code, and you will only have a 3-character code for this because there's no other characters required for an 080 code. If you will look in the tabular, it tells you in those orange notes, it says use additional code to indicate the outcome of the delivery, and it gives us Z37.0. So now we know that we need a second code. As the outcome of the delivery, we need to get a Z code. So let's go look at Z37.0. Okay, if you go back in the tabular where Z37.0 is, it states a single live birth. So that's just stating that we had one child and it was a live birth. It was a fine birth. So your second code for number 13 is going to be Z37.0. Now we've captured everything diagnosis with our mama. Now we need to capture the procedure of the delivery, because there is a procedure of the delivery, and that's the delivery. So we're dealing with OB, right? So first thing we're going to do is go to the obstetric part. It was a pregnancy, so there's only one to choose from, so we will choose from that. Now, what do we choose from here? Well, there was nothing other than there was a delivery, right? The patient just delivered a natural live-born baby vaginally, so we're going to hit delivery. So delivery is just assisting the passage of the products of conception from the genital canal, which means the vaginal delivery. So this is where this procedure comes from. Okay, that's what that stands for with delivery. And there's nothing more, there's no choices for us. We know it just right across the board. There's products of conception, it was external, with the device, there's no device, and there was no qualifier. So your code for your procedure of your vaginal delivery is going to be a 10E0XZZ, and that captures your delivery code for a vaginal delivery. So you should have 3 codes for number 13. Okay. The last one we're going to do together is number 15, and I think this will be a good one that we need to do together because we're going to have 1 diagnosis code and we're going to actually have 2 procedure codes, okay? So let's read number 15. Number 15 reads, a female patient had a modified radical mastectomy of malignant neoplasm of the right upper outer quadrant breast with adjunct chemotherapy percutaneous central vein. So this is what happened. We have a patient that has a malignant neoplasm of her breast. They did a mastectomy, a modified radical mastectomy of that right breast, and then afterwards she had chemotherapy through the percutaneous central vein, okay? So the first thing that we need to code is the neoplasm, okay? So we're going to go to our ICD-10 CM book. We're going to go to neoplasm because we know it's malignant, so we can go straight to the neoplasm table. We know that it was in her breast, okay? So we're going to go to the neoplasm table and then find breast. Okay. Now, once we go, we know where on the breast. Remember, it is the upper outer quadrant of our bright breast, correct? So we're going to look for the outer upper quadrant. So if we go to upper, because we know it's the upper outer quadrant, we're going to go to breast, upper, and then underneath that you will see upper outer quadrant. Now, we know that it has to be our primary site because there's no other sites recorded, and this is just the breast, and it is our primary, and it's malignant, and it gives you C50.4, okay? So now in the table, we know where to start at C50.4. We're going to go check that in the tabular and get the rest of our characters for our code. So everyone go to C50.4. Okay, so once you get to C50.4, now we need to determine C54.1 is malignant neoplasm of the upper outer quadrant of the breast in a female. And then the C50.42 is the male. Well, we know we're dealing with a female because it states female, so we're going to be under the category of C50.41. Now we have further characters now that we're under the female. So we look at C50.411, and it says malignant neoplasm of the upper outer quadrant of the right female breast. That is what we're dealing with, is the right breast of a female. And so our code, our diagnosis code for this malignant neoplasm is C50.411. Okay. Now we need to capture the procedures. So we're going to go back up to our table. The first thing we are going to do is we're coding the mastectomy, okay? If you do not know what a mastectomy is and what that constitutes for and what that is, you need to go and Google that. A mastectomy is a removal of the breast, okay? So we know that it is a medical and surgical removal, so we're going to go medical and surgical. So our first character in our code is going to be a 0. Now we're going to look on the body parts, okay? Well, we know we're dealing with the breast, okay? So this is where our body system is, and so it's a 0H. So we will click on that one. Okay, now we're dealing with the operation. Remember, a mastectomy is a removal of the breast, okay? If you remember, I'm going to go up. If you don't know what procedures are and what they mean, you need to go to definitions, okay? And you can scroll down, and here they are in alphabetical order, okay? All the different things. If you remember from our previous one, and when we were removing the appendix, it was resection. If you will go down, here's removal. It gives you taking out or off a device from a body part. If you look at resection, that's restriction. Resection, there it is. Resection is cutting out or off without replacement all of a body part. Well, that's what a mastectomy is. It is removing the breast. Okay, so we know it's going to be resection. Let me get back to the table. So we're at medical and surgical. We're dealing with the skin and we're dealing with the breast. Now we know a resection is a removal, so we're going to hit resection. Okay, so now that we know that it's a medical surgical, we're dealing with the breast, and we are cutting off without replacing the breast. So it's a resection. So your first 3 characters in your code is 0HT. Now we need to get the other 4 characters. So this is our body parts. What are we dealing with? We're dealing with the right breast. So our 4th character is going to be a T. So since we're in this box, we're going to come right across and follow it. So our 5th is going to be that it's an open approach. We have no device and no qualifier. Okay, that's the finish of our first procedure code. So your first procedure code for the mastectomy is going to be 0HT T0ZZ, and that captures our mastectomy of our right breast. Now we need to capture our last procedure code, and that is chemotherapy. Okay, they did it along with, they did a mastectomy, and she did a chemotherapy right after the mastectomy. And they did it percutaneous through central vein. So now we need to capture the chemotherapy. Okay, so when we're administering a drug, if you did your reading, you're administering a drug. Chemotherapy is a type of drug. So we're administering it. So we know we're going to be going to administering. Okay. It's physiological systems and anatomical regions. That's how we're giving it through. Okay. It's not part of our circulatory system or indwelling device. So we're going with our physiological systems and our anatomical regions. Okay. If you don't know what those are, you need to go back up to the definitions and read about those body parts and body systems, and that will help you understand. Remember to always look up all those definitions if you don't understand anything in this section. Okay. So our second character in our procedure code is going to be E. Now we need to know which one it is. Are we dealing with irrigation or introduction? Well, it's an introduction to the chemotherapy. If you don't know the differences, again, you need to go up. If you don't know the operational values of something, you need to go up and read on it. Okay? If you don't know which one of these are, go back up and find out, and it'll make it so much easier to find. It is the introduction, chemotherapy. So let's read about it. We're administering to the physiological systems and anatomical regions. The introduction is putting in or on a therapeutic, a diagnostic, a nutritional, a physiological, or a prophylactic substance, except blood or blood products. Chemotherapy is not blood or a blood product, so we know that we're good. This is the section we are dealing with. Now we have to go for the 4th character. Our first 3 characters are met, 3E0. Okay, now we know that we're dealing with a central vein, correct? So I'm going to come down until I find where we're putting it at, the body region. There's peripheral vein, but we're not dealing with the peripheral vein. We're dealing with the central vein. So we're going to keep scrolling down because this is a big section. Okay, here we found central vein. Okay. Now that we found central vein, it's not open. We know where it's at. It's percutaneous. Okay, it's in the percutaneous central vein. So I'm going to come down to central vein till I can find percutaneous. And I've made it. So now we're in the central vein. The approach is percutaneous, not open. It's in percutaneous. Now that I've found central vein and percutaneous, now we need to find which one of our substances we are putting in. So what is chemotherapy? If you don't know what chemotherapy is, you don't know what substance it is, you need to look it up to see what kind of substance chemotherapy is. Chemotherapy is an anti-neoplastic substance, okay? So our fifth character is going to be a 0 because chemotherapy is an anti-neoplastic substance. Now, we need to decide what our 7th character is going to be. We found our 4th, and our 5th, and our 6th. Now it's our 7th, and it's going to be in this section, okay? We do not have any information that is a high dose interleukin 2. We don't have that it's a low dose. We don't have that it's a monoclonal antibody or a chlorphenamide. So what we have to do, since we don't have that information, we have to go with other. Okay, other anti-neoplastic. You cannot code 2, 3, M, and P because we don't have that information. If we had that information, the qualifier, then we could do it. But since we don't, we have to go with the other, which is 5. So the second code capturing our administration to chemotherapy is 3E04305. And that is our last and final procedure code for number 15. I hope that this has helped you and made you feel more comfortable with coding in the procedures, and I hope that doesn't scare you that I've added your diagnoses along with your procedures. Don't let that scare you. That you need to do that, and that's part of coding. You're going to be coding diagnoses and procedures, especially if you are in a facility. Always remember, always, 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 your diagnosis codes are always coded before your procedure codes. So any ICD-10, CM codes, they're going to be coded before your procedure codes. If you have any questions, please post them in the question board or feel free to contact me via email or through my cell phone or office number. Have a nice night.